Hello and welcome. My name is Nicholas Hall, founder and president of Graham's Foundation, and I'm your host for today's Healthcare Industry Chat with Jaylee Hilliard, Senior Director of Clinical Strategy at AngelEye Health. I founded Graham's Foundation in 2009 in memory of my son, who died as a result of his premature birth. Our mission is to inform and guide parents of preemies so that they may confidently navigate the journey of prematurity. We provide support through our care package program, our Preemie parent mentor program, our My Preemie mobile app, and our online community. So with that, I want to welcome Jaylee Hilliard, Senior Director of Clinical Strategy at AngelEye Health. Hello, Jaylee. Hi.
Hi, thanks for
Welcome.
having me today.
Yeah, absolutely. Okay, so first things first. I noticed your name has 14 letters, I think. 2, 3, or maybe, no, 15. Let me see. Yes,
14, you were right.
14, right? But the letters behind your name, I think there's as many, if not more.
I think it's the same amount, probably, or more.
Right?
You're right.
Yeah. And I'm sure you did not get those by just simply going online and registering and filling out a few forms. I'm sure those were well.
Unfortunately, not. It's funny you mentioned the letters. I was just talking to someone today about those being, from my perspective, the equivalent to like Girl Scout badges. And yeah, it's a lot of work to earn them, but happy to have them, proud to wear them.
Yeah. So I think RN is registered nurse,
Mhm.
but could you help illuminate us on what are some of those other acronyms? What are they?
Sure.
Yeah, I'd love to know.
Sure. So I have a master's in nursing leadership and healthcare policy. I'm a registered nurse and I am board certified as an advanced nurse executive and
Huh?
then certified in patient experience from the Barrel Institute as well.
Is that what all those letters
Uh,
equal?
so the NEABC is the Nurse Executive Advanced
Okay.
Board Certification, and the
Yeah.
CPXP is Certified Patient Experience Professional.
Wow. So if I interpret that, on the one hand, as a registered nurse, you can actually do the work,
Mhm.
right? You did the work.
I
You've
did
done the
it.
work.
Yeah.
And the rest of it is around perhaps more of supporting the nursing industry or from a leadership perspective, maybe managing a team within a hospital setting. Is that a
Yeah, I think that's fair to say. Understanding, the clinical operations behind helping a NICU work and
yeah, yeah.
operate on a day-to-day basis, leading a team. And then I've always had, a passion for patient and family experience as well,
Mm,
which is what led me to get that CPXP.
gotcha. Awesome. And so it makes a lot of sense, and we're going to get into more details of about the history of Angel Eye Health and obviously what Angel Eye does to support families. But given your background and experience, it certainly makes a lot of sense that joining Angel Eye when you did in 2019 and kind of where they are, where they were, and where they are, and what they want to be in terms of supporting the family experience in the neonatal intensive care unit certainly makes a lot of sense. So I'm sure they are lucky to have you, as you are lucky and happy to be there. I did note that you joined in 2019, so pretty great timing. You joined just before the pandemic,
Oh
when
yeah,
all
totally
when,
planned.
right, and that was like I mean, again, for me, having been a parent, spent 119 days plus or minus a couple of hours in the neonatal intensive care unit, and being there every day and being able to come and go as I pleased. I can't imagine what it must have been like for parents all of a sudden, can I go in, can't I, only one at a time, and just the sheer, you know, the overwhelm of that particular period of time. But also, I think, as I understand it, there's still sort of repercussions and still some impact from that. And it was a particularly challenging time from a staffing perspective. And so, but that also presented then the opportunity for, okay, what are alternatives for families? I'm sure not just in the NICU space, but throughout the whole hospital system, of how can we communicate with our patients and with our families, given these challenges. So you've got that. And then, if I'm not mistaken, you have a daughter, Everly, who is what, 2.5 now?
She just turned 2. So I actually was pregnant with her in the pandemic, and had her also in the same level 4 NICU where I was the director at McLean Children's, Baylor Scott and White. So I feel like at this point I've had the full 360-degree NICU experience.
Right.
So yeah,
you didn't do it. You did not do that electively, correct?
No.
Hey, it's time right now. We're at about 32 weeks. Looks clear. Let's give me the full. Yeah. No.
Yeah, not at all. Had a really typical pregnancy, but am grateful in hindsight for the experience, so that I could really, better understand what families were going through during such a unique period of time. And that's definitely something that I'm also passionate about right now, is just understanding family experiences throughout the pandemic. And as you mentioned, what are some of the ways that we can leverage technology to help support families, whether it's a pandemic or not? And how can we move forward into a world where families really are engaged and invited as critical members of the care team for their child, regardless of what's going on in this crazy world of ours?
Right. Yeah, it's ever changing. No one, folks sit around looking at their crystal balls, but I think they're pretty much wrong all the time. So
yes,
you never know what tomorrow's going to bring. Why don't we go ahead and kind of jump into the discussion? It would be helpful, I think, for those that are listening that perhaps are not familiar with AngelEye. I know you're in a lot of your solution is in a lot of the neonatal intensive care units, but there's plenty still that are not. So they may, those parents may not be familiar. I remember seeing AngelEye. I know it's been around 10 years. Graham's Foundation has been around 13 years. So I was on the conference trail before AngelEye hit the. I know I think your competitor was there a few years before, and noticed, a camera in the isolette. Okay, but what do I do? I don't really want to just look at my baby. That's I want to more than that. And so obviously you've come a long way, but that's sort of where, as I recall, it kind of started with a solution for a video camera for parents to be able to see their baby when they weren't there. But now you talk about an engagement platform. So perhaps you could get us up to speed on kind of the today's AngelEye Health from a solution and platform perspective for the NICU.
Yeah, absolutely. So as you mentioned, we're celebrating 10 years this year. So we're so thankful to have had the opportunity to serve so many families and care teams for this many years. We started out, as you mentioned, as bedside cameras that would allow parents and additional family members to be connected with the child when they were in the NICU. And that expanded really quickly into noticing how engaged families were. It's a free app that families download to access that, and they can invite additional members of their family to view their child as well. So it's really great, not only to feel a part of the family and connected to the newborn baby in the family, but also to understand what's going on a day-to-day basis, so that additional friends and family can support that, family dyad as they're going through the NICU experience, which we all know is so unique and complex and challenging. So That's really how we started out. And then we noticed that families were logging in 5 or 6 times a day. They wanted to be connected to the child. And it allowed them to have more peace of mind, feel less anxious. And a lot of families struggle with going back to work while their child's in the NICU, having to provide for their family, or even having siblings at home, or just the sheer distance they live from
Yeah.
their child. So I think a lot of those concerns as a parent, do I need to be at the NICU all day so I can make sure that they're okay? Or can I have that peace of mind to know that I can go to work or spend time with siblings? So our technology really allowed families to have that peace of mind when they couldn't be there. And I think alleviate some of the guilt that parents feel when they're having to choose between one part of their life and the other.
Mm.
Um, so several years ago, we added two solutions: online education, which allows families to receive resources and education, so that they can stay abreast of what's happening with their child and prepare for taking their child home. Those resources are also available after they go home as well. And
Mhm.
then we have what is called Patient Connect, which is a secure, HIPAA compliant way for the care team to send one-way photo, video, and text messages to families throughout the stay as well. So it's great when they can't be there for bath time or special moments, or to see therapists working with their child, or even just to get an update on rounds and what the plan of care is for the day, or meet the staff that's caring for their child that shift. And then more recently, we're seeing that be used to educate families as well. So if you're taking a child home that needs, a special formula that needs to be mixed, or equipment that is going to be utilized, they can do training and allow those videos to be watched after they've gone home as well. So those were the first two additional solutions. And then most recently, we've added Milk Tracker, which is an end-to-end feeding management solution that supports staff in safely and accurately delivering the right nutrition to patients,
Mm.
but it supports families, and that parents enter their breast milk pumping sessions into the application and have insight into the inventory they have at home and at the hospital, really integrating them into part of the feeding plan and nutrition plan for their child. So we're really trying to round out our platform to engage families in every aspect of their child's care. And we have some exciting things coming up on the roadmap as well.
Wow. Okay. Where do I
There's
begin?
so
So
much. I
yeah.
know. It's
So
so
it's
hard to get
yeah.
it
So
all available.
a lot has developed since the early days of deploying video cameras and isolates. Obviously, I'm curious. What if any are some of the cultural challenges maybe that you face when implementing the AngelEye platform in at a neonatal intensive care unit? Because all of a sudden this is an entirely different mode of communication with the families. I would think.
Well, from a staff perspective, just culturally, how a NICU works, historically, they were fairly closed off, and the care team really took ownership of caring for the child and kind of handing them over, if you will, to families as, discharge was nearing. And
Right.
so, as we've started to work, harder to engage parents early on in the care of their child and understand all the benefits of doing so, our platform is really supportive in helping families be educated and engaged and empowered to care for their child much earlier. From the staff perspective, having this new piece of equipment is definitely different and new in their space. So having to adjust and know that parents are there virtually when they're not there physically is
Yeah.
definitely something that we have to overcome. But I think we've built or I'm confident that we've built our technology in a way that really supports staff and being able to provide the best care that they can, while also giving parents insight and family members insight into what's going on with their child. I wasn't sure if you meant culturally, like from the NICU culture perspective, or from like the family cultural perspective.
Yeah, more than NICU. As you know, as I've learned, and you know better than I, every NICU is its own little fan.
Ecosystem.
It's its
Yes.
own ecosystem. Doesn't matter if it's the same. It's all. It could be. It could say Kaiser on the in California, but they're still their own. They all have their own culture and their own methodologies, and just that is introducing a new mode of communication with the families that is
Absolutely.
other than what they're used to. I'm sure. One of the
Yeah.
things that took me, I didn't discover it until, unfortunately, I didn't discover it until being in the NICU for a couple of months, was that I could join the staff when they were having their rounds and they were at the bed at my baby's isolette and having a conversation about my baby. And that was really, like, it was enlightening for me. Also gave me an opportunity to use my voice. I'm curious because and you have to you got to be there when it happens, right? And so
Sure.
that's one of those things where you kind of have to have an idea of knowing when it's happening. And so, are there ways that with the platform, are there ways that kind of information at this point is shared with the families? And if so, and I'm sensitive to, you talk about that the goal of the platform is to ultimately save staff time. And I think one of the challenges of phones, with text, with email, with messenger, with this, with that, is you actually create duplicative or more communication. So I'm sure there's been, like, you guys have been learning over this period of 10 years of, what form of communication. You mentioned one way that,
Mhm.
staff can. So I'm just sort of curious, where you've seen, or where the staff have seen, like, where the light bulbs have gone off, like, wow, okay, this is really making life easier. And maybe what some of the, also what some of the challenges maybe that you still see, and that you're hoping to continue to overcome.
You'll have to stay on top of me here if I don't answer all of those
That's
questions.
okay. That's okay.
Let me start with the first one. Are there ways to include families in rounds? And the answer is yes. So the care team can provide either audio and video of what happened during rounds, or real time could record rounds as well. We see a lot of providers either go back to their office or be at the bedside, obviously, as best practice, to update families on what's going on with their child over the last 24 hours and what the plan of care is for the next 24 hours. So that's a really great way for the care team to loop families in and just notify them of those changes kind of real time, so that when families are able to see their child, they're not surprised if there's a different respiratory device or a different line or something visually that they're seeing.
Yeah.
So they can really real time, families will receive a push message that let them know that there's a new communication to review. They would log in and be able to view that recording, or it could even be text if the provider wanted to type out information. It's completely secure and HIPAA compliant. So they could communicate however they'd like to those primary caregivers about what's going on with the child. And then the next question I think you were asking about was, what are some of the light bulbs that have gone off with the technology? And, anytime you have something new, it's obviously hard to adopt a new practice, a new workflow, welcome a new piece of technology or hardware into a unit, especially when you're taking care of such high acuity and critical patients. But once staff really open up and give the technology a chance, we hear time and time again how much more efficiently they're able to update families with what's going on. Every NICU parent, I don't want to say every, but most NICU parents call and ask the same question every single day. There's the basic information I want to know. How much did my baby weigh last night? Did they gain or lose weight? How much are they eating? Did they spit up? Have they peed and pooped? All of those basic things. And so as care team members, we know what those things are, and we can proactively go in and provide those updates in our application, so that you can avoid maybe some of the parents calling when you're in the middle of hands-on care with another patient, for example. So it's on your timeline, and when you're able to sit down, look at what the plan is for the day or what happened last night, and proactively reach out to families to keep them updated and in the loop. Also, a lot of families these days are not answering phone calls or prefer not to talk on the phone. So having the ability to send a quick message through our application has worked well with, the folks that are working in the care team in the NICU now, and with families too. So being able to have the accessibility to quickly send a message or real time send a picture. You put the baby on the scale to weigh them, send a picture of the baby on the scale to the family. And you can also know that, a lot of times if the NICU did call my phone, for example, I remember just instinctively feeling like my heart sank. I couldn't breathe. They must be calling because something's wrong. In the AngelEye application, it's really easy to get push notifications or alerts that are not a phone call, but they're positive interactions and communication. So I think it's a way to alleviate some of the anxiety and stress of people calling you on the phone, especially if it's after hours or in the middle of the night, which very oftentimes staff or care teams may have time then to communicate with families.
You were reading my mind, actually. I can remember before when Graham was alive, he just wasn't well, right? Lived for 45 days, but really never had any good days. And so the anxiousness of, calling every morning to see how the night went. But also, I can also imagine the parent getting a push notification.
Mm-hmm.
I can imagine a little bit of anxiety, and so, developing, I guess, the rapport with the staff and for them to be able, for sharing. I think it's really important that you share if there is a milestone or if there is, the simple, feeding or, something, again, if they can't be there. I was fortunate to be able to be there every day. So a lot of the experiences, I was able to kind of be there firsthand, but obviously you're looking to help supplement. Your solution is to supplement for those parents that, can't be there every day or can't be there as often as they would.
Absolutely.
They would like to. Yeah. Now, is the solution, do you find that if you're in a neonatal intensive care unit, do you tend to focus on, babies that are under a particular gestation or, in isolettes versus in a crib? I think the average NICU stay is a week, but that's because many of them are there for a couple of days for observation, and then there are plenty that are there for 2, 3, 4 months or longer. Have you found that the parents that naturally really kind of use the solution are there for a couple of weeks or longer, or even shorter stay? Is it found to be helpful and beneficial?
Sure. That's a really great question. So what we do know is that regardless of how sick or ill the patient is, from a clinical perspective, families give feedback that they want that connectedness. They want to be aware of what's going on with their child, and they are equally concerned about what's going on with their child, whether they're there for a few days of antibiotics or they're a 23-weeker fighting for their life.
Yeah.
When it's your child, something I learned also becoming a NICU mom myself about 2 years ago is it really is true what we try to teach about equity and making sure that every parent is having an equal opportunity to engage with the care of their child. And we have to respect every parent. I mean, it's their child that's there. So as a care team, we know these patients are sicker or are higher risk for certain
Yeah.
things than others. But when you're the parent, that child's the most important person to you in that NICU. And so I think as a best practice and to ensure that we're providing equal care to families, regardless of what's going on with their child, if they're in the NICU, I think they all deserve the ability to have access to be engaged, informed, and to have that insight. So I can say fairly confidently that it doesn't matter if there's specific gestational age or a specific diagnosis. That we get really positive feedbacks from all of our families. A colleague and I also recently did some research on NICU families and their experience during the pandemic. And one of the really cool pieces of information that we discovered after we ran the statistics on that was it didn't matter how early the child was born, like prematurity wise, or how far they lived from the hospital. The parents were equally impacted by the trauma they experienced of being separated from their child, regardless. And I think that is just, one more layer of just kind of adding to the picture and understanding what these experiences are for families and how we can continue to support all of them, regardless of where they are in the journey.
Yeah, absolutely. Yeah, to some extent, if you're there for a long time, like I was, it can sort of become normal in after
Sure.
months and months. And but the goal hopefully is to one day transition home and bring your baby home. And um, one of the reasons why at Graham's Foundation we focus on the journey of prematurity versus specifically the neonatal intensive care unit, we know that all of our families start in the same physical space, but we know that ultimately the goal is to be able to bring your baby home. And when you do that, as excited as you are, you find out that you no longer have a doctor or a nurse to just wave your hand and say,
Sure.
I've got a question. And the degree to which you have a pediatrician that understands or has the time, it can be quite an overwhelming experience. And there's varying degrees of of training and preparation for the transition home, depending on where you are. So I'm curious. I do know that you are with your platform making some efforts to help support the transition home for families. So I'm just curious if you could maybe share with our community a bit more about efforts you're making to help support the transition home.
Sure, absolutely. Um, so we are in the process of doing work to better understand what some of these challenges are as families transition from NICU life to home life. Um, Part of us better understanding this is collaborating with the National Perinatal Association. They just published some really wonderful guidelines about preparing families to take their child home in that transition period. So we are supporting those efforts of those guidelines to get pushed out to NICUs around the country and really try to streamline that discharge readiness process, and what that support looks like after they go home. So AngelEye Health is definitely committed to understanding what some of the challenges are that families face, but also some of the struggles and challenges that care teams face. And we've conducted many, many interviews with families and folks at hospitals that spend their time every day coordinating, getting these families home, the equipment they need, the education and resources they need to help support them. And so we, as I mentioned previously, we have our education platform where we're already delivering education, information, and resources. We have our communication platform where we're providing, training that can be done one-on-one with a patient and the family members or care members so that they feel more confident when they go home. But we're really looking at ways to further ease that transition by allowing families to know what are the tasks that you as family members need to complete as you prepare to take your child home. What are some things that you need to keep in mind? And what are the things that you're looking for in your baby to know where are you kind of on that path to going home? Do you still have a long way to go? Or is it getting nearer and nearer? And I think that's something a lot of families struggle with is gauging how close or how far away they are from taking their child home, and every baby being so different. As you mentioned earlier, everybody wishes they had a crystal ball, but you really have to look at the keys and clues that the baby is giving everyone on their readiness, and just be prepared for whenever that time comes. And for some babies, it's longer than others. So we are committed to understanding what those challenges are from the family side, and also from the care team side, helping parents understand what needs to be done from their perspective, things they can control, so that when the baby is caught up and they're ready, they are more confident to take them home. And then looking at ways that we can continue to provide communication and resources and tools after they go home to kind of bridge that gap between the NICU and really getting established and feeling confident in your medical home and your community. As you mentioned, you go to a pediatrician visit, you have many specialists that you might be visiting. Some communities are fortunate enough to have complex care clinics and more robust programs, but not all of them. And sometimes they have to travel pretty far to go to those. So it is scary when you take your child home and all of a sudden it's up to you to keep them alive and thriving. I know with my own daughter, we had to follow up with pulmonology. We had a NICU follow-up clinic, a pediatric cardiologist. She had medications of fortifying her milk. And that's a lot to manage on a day-to-day basis when you're also sleep deprived and adjusting to life at home. So anything we can do to really help, extend a helping hand, if you will, and support families throughout that time frame is what we're looking at. And we have some really exciting pilots starting this summer with some new ideas for ways that we can support them in those ways.
No, that's great. I will do a plug for Graham's Foundation. We did contribute. We were on the part of the committees that were developing the material that the NPA ultimately published, and
great
support materials, right? And also just a reminder to the community of our peer mentor program. We have nearly 40 peer mentors, and all of our mentors have been through the journey of bringing our babies home. Some of us, we've had loss. Some of us have had we sort of developed different areas of expertise because of what our babies have gone through. But we've all, brought our babies home. We know what it's like to have to juggle all the responsibilities, and if nothing else, someone to help, just to listen. And then if we have a suggestion or two or a good question to ask, but ultimately our mentors are here to listen and to help the parents become advocates for themselves. I did want to, you had mentioned in a little bit of the material that you had shared with me that some of the challenges, willing to acknowledge that you talk to counselors of your personal experience of being in the NICU, and we are finding that is not at all uncommon. There are many of us that seek a lot of different methods and modes of support. And I think we have a tendency to kind of put our head in the sand. We're going to get through this. We're going to fight through it. We're going to work through it. And then everything will be, and it's like, doesn't work like that. Life just doesn't work like that. And so, we are starting to talk to more parents really specifically about mental well-being, physical well-being. I think it's something that we acknowledge, but it feels more like something that you have to somehow opt into. Like someone has to, and that's not what the staff are there trained to care for a baby, not ultimately. And maybe there's one social worker that's so I can see where there can be parents can have a need and it's not detected, or it's parents put up a good face and it kind of really presents itself after you've gotten home. So just, I guess I didn't really have a question in there, but it was more like anything that you're willing to share about your own personal experience, and just any words of encouragement that you might have for, a parent that's listening to this right now, and maybe having those kind of feelings that they benefit from help and support, but maybe they're not sure where to turn.
Yeah. No, I appreciate you bringing that up because, so I had Everly really unexpectedly 32 weeks and 6 days. I had been a NICU nurse in that unit. I had been the director of the unit. I knew a lot of the staff and the providers. I had somebody tell me after having her, gee, Jaylee, you must have just been the most ideal and the perfect parent to have a baby in the NICU. And I was like horrified by that comment, because the truth of the matter is no. Like, there are so many reasons why I felt like, no, I was not an ideal parent, because I was so worried about all of the what ifs. And I had an incredible amount of anxiety, especially knowing initially that I was being admitted and monitored for this undisclosed amount of time. So I was going to be in the NICU for, up to 6 weeks and not be able to leave. And it's the pandemic, and the only person that can be here with me is my husband. I'm like, we're definitely going to kill each other if we're the only people allowed in this room for 6 weeks. Yeah. So that was just very stressful, being isolated during that time frame and feeling really alone, and not like I had a lot of, people that understood what we were going through. Everybody's worried about the baby, right? Like, is the baby okay? And I'm like, yes, the baby is fine. It's my blood pressure and preeclampsia. Like, my body's not okay. And the only way to solve this, I know, is to deliver her. And luckily, with my background and experience, I knew I had, the 2 doses of steroids. And after that point, I was like, okay, if she comes, she comes. Yeah. I feel confident where we are and who's caring for her. And I'm going to give the rest to God. And we'll get through this. But it was extremely stressful. I had, I have had anxiety since I was in kindergarten. I have struggled with anxiety in my personal life and panic attacks. But prior to getting pregnant and prior to being admitted to the hospital with her, my anxiety had been under control, and I was doing great for years. Like, a lot of people would not even have any idea that I struggled with that. Yeah. And then after delivering her, it really spiked my anxiety and all of these what ifs and fears. And I felt like for the first year of her life, I was just living in this haze, this fog. And in hindsight, it's painful to think about, because I feel like there's so many things that I wasn't really present for, or that I didn't take full advantage of, because I was just trying to push through and go through the motions. And you are so busy, and one day this fog will just disappear. But for me, I was doing as good as I could at the time. And then my anxiety just got to a point where it was just really debilitating, and it was hard for me to function and focus and having panic attacks every day. And I finally admitted and acknowledged to myself that, like, you need to talk to someone, you need help. And I reached out and I started seeing, there's so many programs now. You can see people even virtually to help you manage medication or therapy or whatever you need. And I started talking to someone 3 times a week until I could finally figure out, like, what are some tools in my tool belt to help me cope and get my life back together and recenter and reground and refocus myself. And it took a lot of hard work and it was painful and I shed a lot of tears, but it was also really therapeutic. And I feel like since I've been able to do that and talk to people and I've been more open about it and met other, NICU moms that have gone through a similar experience. And I know that it's okay to not be okay. I feel so much better about it. I have a community around me. And I feel like I'm doing so much better than I was. But it was kind of like you mentioned, my body just got to a point where it had been a year and it was like, you can't keep not acknowledging this anymore. And so if there's anybody out there, I would just say that, like, you're not alone. And most importantly, like, it's okay to not be okay. Going to the NICU, whether are familiar with the NICU like I was, or whether you've never stepped foot in one in your life, it is a very traumatic experience to be in a place where you have so little control and there's this most important human in your life and you are giving, you're basically helpless to some extent in helping them thrive. So I would just encourage you to, if you're in the NICU now, talk to the care team about things that you can do to give your child, the best chance at life and the best outcomes. And if you've been home for a while, reach out. And I'm so thankful that there's organizations like yours, Nick, that have taken mental health so seriously and have mentorship and support programs available, many cases free of charge, or just somebody to talk to. There's lots of resources out there. Do not be afraid or embarrassed to reach out and get help so you can start living again.
Yeah. And I think you pointed to that for you, given that anxiety was something that you've managed for a long time, that, the premature birth of your daughter was a triggering event for you. That's not something that I have, the anxiety is not something that I've managed. That being said, I did have some events a few years ago that really kind of brought back the loss of my son and that experience. And so it had been 10, 12, 13 years, but, our memories are always in the moment. Our thoughts, our ideas are always in the moment. And so our minds are extremely powerful in beautiful ways and sometimes rather challenging ways. And, I did the same as you and, and sought different forms of support, and have continued a lot of those modalities to this day and have really, it's made a profound difference, not only just for the issue that I wanted, that I was interested in transforming, but then in all other areas of my life as well. So yeah, for any parent cannot, whether it's just a friend to talk to, someone to listen. Certainly if you're going through the experience of a premature birth, I think the benefit of talking to a mentor, whether your NICU offers mentors or GRAMS or other organizations, is that there is a shared language, there is a bit of a shared understanding and appreciation, but hopefully a good mentor knows that it's about your mentee, it's about the story they're sharing, not about your story. So anyhow, thank you for sharing, for being willing to share that.
Absolutely.
Yeah, as we wrap up, our discussion, is there anything else, I guess, that you'd want to share that maybe we've covered a lot of ground, and I'm sure we'll be able to talk again, but is there anything, today that you'd want to maybe share that you haven't had a chance to share?
Well, that's a good question. I do think we've covered a lot of ground. I just, for families out there, I would just encourage you to, a lot of times, especially right now, resources are spread really thin in the NICU. And if you are struggling with what's going on, I would just encourage you to not be afraid to reach out or speak up to the bedside nurse or the care team and let them know that you need help or you're not okay or you don't understand something, because all of these folks are here to support you and your child. And many times it's just the lack of communication or not knowing. And when you're caring for so many babies and so many families over a period of time, it's hard sometimes to stop and pause and just check on you and make sure you're okay. So please speak up. And then also just to know that it's never too late to get help or to ask those questions that maybe you didn't and you wish you would have about your child or your experience. And then I would encourage you, if you are, interested in learning more about AngelEye or ways that our platform or technology can help your organization, or interested in finding ways in getting our platform installed in a hospital or location near you, we'd love to talk to you about ways to collaborate. We always get really excited when families or organizations reach out and want to help, co-fundraise for some of this technology. It's hard in healthcare systems today to, kind of weigh, I need new incubators, I need new ventilators, and then I also need this technology to keep families connected. And so anything you can do to advocate for our technology or to learn more, we'd be happy to share that with you.
Parents are the best parents that have been through the journey.
Yes.
They're the best salespeople, right?
Absolutely. You guys are passionate, and when you get something in your mind, you are going to deliver. So would love to have a crew of Preemie parents out there helping advocate for our technology. Also, if you're interested in learning more, we occasionally have focus groups or advisory opportunities on some of the new solutions that we're delivering. So if anyone's interested in participating in something like that, we would welcome that as well.
Awesome. Well, Jaylee, thanks so much for your time today.
Thanks,
really appreciate it.
I appreciate it. Have a great day.
Take care. Well, before we wrap up today, I want to take a moment to thank our longtime partner and supporter, Pampers, for their underwriting of today's healthcare industry chat. And thanks once again to Jaylee. Thanks again to Pampers. And thank you to our Preemie parent community for placing your trust in us to provide you with information and guidance to help you confidently navigate the journey of prematurity.